Hello, everyone. My name is Bernadetta Janusz.
My name is Joanna Pawelczyk.
My name is Józefik. In our paper entitled How Therapies Respond to Uneven Alliances in Couple and Family Therapy, a conversation-analytic study, we look into how uneven alliances with family members and spouse or partner are created in family and couple therapy. As we know, creating equal bonds with every therapy participant is really the most challenging task for many therapists.
We wanted to explore the problem of creating uneven alliances by scrutinizing the micro level of therapeutic interactions, more specifically, the therapist's lexical choices, turn-taking, pauses, quality of voice, and other features of interaction. Using the method of conversation analysis, we relied on the concept of asymmetry of affiliation to name recurring patterns of interaction in which a couple or family therapist establishes an asymmetric relation between themselves and the couple, interactionally favoring one of the spouses or one family member.
Having identified and described those episodes of asymmetry of affiliation in therapy sessions, we then looked at the interpersonal process recall interview data to examine whether these asymmetries of affiliation identified in the session are recognized and reflected upon by the therapists themselves in a non-therapy context. Interpersonal process recall interview is an instrument used to investigate professional talk. During the IPR interview, the therapists view a video recording of their work right after the session or up to 24 hours following it. Most importantly, they can share with the interviewer their thoughts, feelings, and reflections concerning any aspect of the session.
Our interactional analysis revealed two different ways of how therapists during interpersonal process recall interview responded to episodes of asymmetries of affiliation in the sessions. We labeled the first way as therapist exclusive identification with one participant. As in these instances, while watching such episodes of asymmetry during the IPR interview, the therapist still talked about the behaviors or life predicament of one person only.
On the other hand, the second way involved therapists' investigation of their agency in the emergence of asymmetry. This is when therapists commented on the ongoing interaction and uneven alliances in the session. Thus, in this case, the therapists were able to notice the asymmetries in how they managed their relations with therapy participants and often reflect on their own interactional behavior.
We also pose questions for further studies. That is, how the skill of recognizing one's own problematic behavior in therapy room, in our case, recognizing the created asymmetric affiliation, can be developed.
Is it, for example, the specific interaction-oriented training that should be recommended for the therapists so they can become more interaction sensitive?
Also, in future studies, we should look into what concrete discursive and interactional practices used by IPR interviewers and psychotherapy supervisors may facilitate or block the therapist's investigation of their professional practices. We very much hope you'll find our paper useful and applicable to your work as therapists. Thank you very much.
Thank you.